whiskey yan. Uy, whiskey. Go deliver.
Hindi ko alam. Sige ko. One watcher. We're gonna design out.
Dinis-dinisin mo.
Timas-timasin.
Ang ganito. Yan, yan, ganyan.
Newborn babies can be assessed immediately by the APGAR scoring system. The APGAR scoring system was developed by Dr. Virginia APGAR in 1952 to assess the health condition of newborn babies. Carried out 1 minute after birth and 5 minutes after birth. APGAR expressed the importance of assessing newborns' vital signs with the use of a scale from 0 to 2. A rating of 0, 1, or 2 is given to each sign depending on whether it is absent or present. A score of 7 to 10 is considered to be normal, while a score below 7 might require immediate resuscitation. Appearance. All infants are cyanotic at birth because of their high capacity of carrying oxygen and the low oxygen saturation in their blood. The disappearance of the cyanosis depends on the respiratory effort and heart rate. A score of 0 indicates that the infant remained gray or pale over the trunk and extremities. A score of 1 indicates that the infant's skin color is pink, with the exceptions of the hands and feet, which is called acrocyanosis. A score of 2 indicates a newborn's entire body and extremities are pink. Pulse. It refers to the heart rate of the newborn during the time is determined by placing a stethoscope on the newborn's chest and listening for heart rate. A score of 0 indicates that there is no heart rate. A score of 2 indicates that there is a heart rate of 100 to 140. Grimace or reflex irritability. It refers to a response to some form of stimulation, such as suctioning the eyes and mouth. It is done to clear the airway to elicit responses of facial grimacing, sneezing, or coughing. A score of 1 indicates that there is slight grimacing with no sneezing or coughing stimulation. A score of 0 indicates that there is no response to any stimulation.
Both. Dalawa. Hello.
Activity or muscle tone. It refers to the amount of active motion of the extremities. A score of 0 indicates a newborn who is limp and without movement. A score of 1 indicates a newborn has some flexion of the extremities. A score of 2 is an excellent score which indicates spontaneous movement of arms and legs that resist extremities.
Shot.
Pababa, Dre. Huwag mo ibika, Dre. Masira. Ikaw din, Dre. Ikaw din.
Simultaneous. Wow. Simultaneous. Pwede yan. Di ba hindi dapat simultaneous?
Okay lang man kayo magalaw man. Kaso lang atin lang. Okay na yan.
Respiratory effort. It refers to the newborn's respiratory effort at 60-second and 5-minute of age. A score of 0 indicates no respiration. A score of 1 indicates that there is a slow and weak cry. A score of 2 indicates that there is a good vigorous cry. Cyanotic at birth because of their high capacity of carrying oxygen and the low oxygen saturation in their blood. The disappearance of the cyanosis depends on the respiratory effort and heart rate.
Pulse refers to the heart rate of the newborn. It is determined by placing a stethoscope on the newborn's chest and listening for the heart rate.
Parang incubator. Joke lang.
This is the reflex irritability. This refers to a response to some form of stimulation such as suctioning the eyes and mouth. It is done to clear the airway to elicit a responses of facial grimacing, sneezing, or coughing.
Hey, baby. Give me your fit. Baby. Ayaw niyo mag-respond.
Stretching ang response niya.
Oo.
I-video mo lang. Hindi, natutulog siya. Ayaw niya talaga.
Tulog ka my feet. What are you doing to my feet?
Tingnan ko. Dugo. Ang dugo.
Baby, sorry.
Activity or muscle tone. This refers to the amount of active motion of the extremities. Respiratory effort refers to the newborn's respiratory effort at 60-second and 5-minute of age. Tingnan ko lang, kapatid ko, pagising na siya.
respiratory rate is determined by placing one hand over the abdominal area of the newborn, taking note of the rise and fall for 1 full minute.
Wala pa. Diba ba? Do.
Ba't yung kupunto lang yun?
Hindi, kahit ano.
Ba, pakita mo kaya kamay ni Alicia na nag-tingin siya sa relo.
Oo.
APGAR test is a gateway for you to fully understand your baby's current health status. It is also done to help nurses and doctors determine what intervention the baby needs.